So I am Lucy Hunt. I'm National Programme Manager for Apprenticeships at Health Education England, and I sit as part of the wider National for Care team. So just to give you an idea, obviously this event is all around careers and in the NHS, but for us the talent pipeline starts very early in terms of work experience. So if it is something that you're looking to get into, it's really good to make early connections with your local trust, just so that you can get an idea of all the range of roles that are available. Huge focus for us moving forward are going to be traineeships and T-levels as well. So T-levels, if you're not aware, are going to be a technical vocational route which are an alternative to A-levels. And it will still have UCAS points to allow you to go to university. So it's definitely something to have a look at as well. As part of the Talent for Care team, our home focus is around widening participation, increasing diversity in the workforce. And so a big part of that now is apprenticeships. And we use those in two ways. One of those is new recruits and attracting new talent into the NHS. And the other one is to be able to upskill existing staff. We've now got apprenticeships available from level 2 all the way up to level 7 master's levels. So today I'm going to give you a talk around what those career pathways look like. So in terms of the NHS, just to give you a bit of context, we are the largest employer in England. So that's over 1.2 million employees and still growing. And we are expected to deliver at least a third of the public sector target apprenticeships. And we have, to fund these apprenticeships, over £220 million of levy per year to spend. We have a target from the government of 28,000 new apprenticeship starts per year. We're still waiting for the 1920 data to be collated, but as of 1819, we were 83% of that target. And despite, a little worldwide pandemic, we are on track to do that for 1920 as well. So it's really encouraging stuff. What does this mean for learners and potential students? So we've got a huge focus on a degree apprenticeships now. And we do realise that in many schools they're still not being advocated or shown as a viable alternative to the traditional university route. For us, it's a no-brainer. A degree apprenticeship means you have a debt-free degree, so it's exactly the same degree that you would do if you were paying fees. You get the opportunity to earn as you learn, and you've got relevant, up-to-date work experience and employers that the employers are looking for. We've got some stats at the bottom there, just in terms of 70% of apprentices stay with the same employer after graduating, 46% receive a pay rise, and 36% reported getting a promotion. So they're definitely a fantastic step in the door. So obviously the NHS is not just doctors and nurses. We have over 350 different job roles available in the NHS, and currently 70 healthcare specific apprenticeships are being used. Here's just a list of them for you to have a look at, but lots of fascinating and varied degrees there, and long time career pathways. So obviously we've had colleagues talking around our AHP degree, so that's the Allied Health Professionals. So these are very relatively new degree apprenticeship programs, and we've had a lot of interest in them. So that's just to give you an idea of the clinical routes that we have. We've also got non-healthcare specific apprenticeships. So what a lot of people don't appreciate is that in the NHS, obviously clinical is a big part of what we do, but these trusts are often huge buildings and businesses in their own right. So backstage, you're going to have IT, finance, estates, human resources. And so just to give you an idea that, there are lots of different roles, and it's not just about the medical professions. We've got huge interest in our cyber security. You're probably all aware of the big cyber breach that we had a couple of years ago. So that's something we have invested heavily in. So if you are interested in IT and cyber security, that's definitely a route in for that, and high demand. And also just basically, customer service, all of the people that greet you on reception desks or answer the telephones when you're calling with regard to employer appointments. There's lots of opportunities there. So just to give you an idea of where the stats were for last year in terms of these numbers that we've got. So our nurse and associate apprenticeship was our biggest one by far, but if you can look, business admin and senior healthcare support workers were also really popular as well. But that's just to give you an idea of the range that's available, and these were the top 20 for 18-19. So we talked about career pathways, and this is why these apprenticeship programs are so successful, because it gives you the opportunity to join at whatever level is right for you. So if you are a GCSE student, you could potentially join on a level 2 program or a level 3 program, it will depend on your maths and English requirements. So we do require you to have an equivalent of a level 2 functional skills or grade. I still get this wrong way with all the numbers, but a grade A to C for GCSEs. So I believe that's the higher numbers. So as you can see on this slide, it's around aspiration. So you can come in at level 2, you can progress to level 3, do the level 5 nurse and associate, and then fast track onto the registered nurse degree. So by fast track, I mean if you did the level 5, that would actually take 2 years off your registered nurse degree. So that's something that you can have a look at and think about deciding what level is the right one that you want to join at, and this would be the opportunity to progress. On the bottom of the slides, there is a link for HASO, which is where we have this pathways tool. So it'll give you a complete range of all the different job roles that are available, and you can click on those to see which is going to be the best pathway for yourself. Paramedic, obviously ambulance is hugely popular on television at the moment, and we've had a lot of interest in people wanting to get into paramedic roles. And here is an example of a career pathway via the apprenticeship route. So you could come in on a level 3 program as an 18-year-old, and then progress to the ambulance practitioner, which is essentially the person that rides along with the trained paramedic in the ambulance. So you'll see that there's always 2, and then you will be able to progress and again fast track onto that paramedic degree. The level 4 will take off a year of the degree program. And all the while doing this, yes, you could go to university and do the traditional paramedic degree, but this way you're getting paid, you're building relationships with your employer, and you're getting those hands-on practical skills and experience which are going to prove invaluable. Another example, we mentioned IT. So again, if IT is your passion and it's something you'd like to do, if you think about it, IT is a huge focus in hospitals in terms of making sure all the systems are up and running. Most trusts, have 10, 15,000 people, so it's never a quiet job. But here is an example of a career pathway for that. So again, you could come in as a school leaver, GCSE, A-level student, and progress up to your degree via the apprenticeship route, all the while getting those hands-on practical skills and getting paid with no student debt. This is particularly popular route because what we are hearing is that certainly with some digital and IT degrees, the stuff that you learn in your first year is essentially out of date by the time you've graduated because technology is moving at such a fast pace. So if you're doing the apprenticeship route, then actually you're getting the opportunity to embed those in your working career and making sure that your skills are up to date. And here again is another route in terms of radiography. So radiographers are the people that are responsible for scanning and imaging, and really important in terms of diagnosing via those methods. So again, here again is another example where you could come in as a healthcare support worker, progress to your assistant practitioner role, and then move on to your degree. And now with the introduction of the level 7 masters, you can actually specialise and get advanced clinical practitioner level 7 apprenticeship via this route. So what is the NHS looking for when we recruit apprentices? So I'm just going to give you some tips. So we're not looking for someone that thinks this is going to be an easy option, that is not academic. For a long time, apprenticeships have had been perceived as the poor relation and for someone to do if they're not necessarily academically gifted, and we think that is really not the case. Certainly for some of these degree level and higher level programs, you are going to need to be very academic, and this is just going to give you an alternative route to be able to progress and get the qualifications that you want to get. We really want people that are keen, self-motivated with that appetite to learn and be prepared to put into practice what they're learning in the classroom. So typically with most apprenticeship programs, you would have 20% off the job, and that can work out that you would be in the workplace 4 days a week, and then at your college or university 1 day a week. Again, it can vary in terms of the delivery method. You might have block releases up front to make sure that you've got the clinical skills or IT skills, whatever the program is, and then you would go back to the office to embed that. But again, that's something that once you apply for these, you can look at the kind of proposed delivery model. We're looking for enthusiasm. I think that goes a long way. And actually, if you can show that you have got an interest in the role. So going back to my earlier point about work experience and potentially volunteering in your local trust, that is a really good way to get a foot in the door and find out around what careers would motivate you. NHS values, anyone applying for a role in the NHS will be asked to demonstrate those. It's really important that you do look at the values and include them in your applications as well. And there is a link there to a kit where you can actually a toolkit where you can actually test these. So the application process, where to find vacancies. Most of our vacancies are advertised on NHS Jobs. We are also more and more using the government apprenticeship website, but I would say that it's definitely worthwhile to make sure that you set up alerts and register for both of those, because while we're working with employers to make sure they're advertising on both sites, NHS Jobs is still the go-to site. So make sure that you sign up for alerts there. Unlike university applications, there's no fixed deadline, so do keep an eye out. We do have regular intakes throughout the year. Certainly for some of the more popular programs, they could even have monthly intakes. So just make sure that you're keeping an eye out for when these vacancies are advertised. The applications will be online via the recruitment portals, and no CVs. Unless you're applying via your training provider, it will be an online competence-based form that you'll complete on this portal. There's lots of hints and tips available, so it's good to do a practice application and get someone to sense check and read over what you're submitting. Spell check. I can never emphasize that people that don't spell check and then they submit an application, which is essentially really good, but it will just turn off prospective employers. So make sure that you spell check. Another tip is make sure that you've got a professional email address. So my background is FE colleges, and the amount of times we would have to reject people because they had inappropriate email addresses. And that's the first thing your employer is going to see. So just make sure, it's a variation of your name and not something inappropriate. So again, there are lots of online free resources to help you with this. So Health Careers, obviously, there's a fantastic program called Step Into the NHS. So again, that's worth having a look at. On Amazing Apprenticeships, they've got some really good resources around the NHS programs. And then there's also the Apprenticeship Guide. As I mentioned previously, make sure that you do register, because the Find an Apprenticeship site in particular is a live jobs website, and vacancies can be uploaded on a daily basis. So it's much easier for you to actually set up an alert to be notified of anything that you're interested in, because obviously there's very high demand for these programs. One thing I would say is when you set up your alerts, look at the radius of the location of where you'd like to apply, because you do need to figure in that you're going to be traveling to this site on a daily basis, so you want to make sure it's going to be sustainable and not too far away from you. But hopefully you will all be able to register with that site very easily. In addition to this, obviously social media, the NHS, we're becoming more and more digital. So do make sure that you sign up and follow these accounts on Twitter, because they all have links to up and coming NHS vacancies. And also we're working with the National Apprenticeship Service on the NHS Apprenticeship Vacancy Snapshot, which will give you an idea. So the idea behind this is that the role of a healthcare support worker, a nurse, paramedic, whatever it might be, it doesn't matter where you are in the country, the job descriptions will be essentially similar. So it's really good to have a look at this site, because it actually just gives you an idea of what the key responsibilities are going to be, the key skills that you'll need to either bring or learn, and just gives you a good idea of what the role is actually going to really entail. So in terms of key messages, so as I said, degree apprenticeships, we're really, really keen for them to have the same parity of esteem as traditional degree routes. For us, as I've said, it's a fantastic opportunity for people that wouldn't necessarily be able to financially afford to do degrees. And also for us, it's a way to attract fantastic new talent into the NHS. It can be an alternative to university or college. As I said before, it still seems that apprenticeships are viewed as that poor relation, but for us, it's a way to earn while you earn, get exactly the same quality of education, but with no student debt to pay back. They can offer a great start to a career and not just a job. So we've talked about the opportunities of career pathways and where you can go from level 2 all the way up to level 7. So for us, it's just, get that foot in the door, and then you can progress, and you might come in as a business admin apprentice and decide that you do want to move into a clinical role, or come in as clinical and decide actually you prefer back office. But again, having that foot in the door gives you the opportunity to see the range of roles that are available. And as I said, we've obviously very high in demand, certainly since the pandemic, but I think you know, we are one of the sectors where actually we're busier than ever, so not had the impact of hospitality or retail or anything like that. We'll actually continue to recruit all the way through, and we'll continue to do so. So here's a link to, if you've not signed up for this newsletter, this is a Health Education England apprenticeship, essentially a one-stop shop. So everything you want to know around apprenticeships in health are there. We've talked about the pathways framework. So again, that's on there if you wanted to go and click in and look at the different roles that are available, and just all the different standards and apprenticeships, and opportunities for you to just kind of see the range of roles that we've got available. Okay, I was supposed to be joined by an apprentice, so I'm frantically seeing if she's emailed me because she doesn't seem to be here. But I'm going to stop sharing my screen. Oh, I'm just seeing if there are any questions. Okay, so Nicosia has said, being in year 12, should I keep a lookout for the apprenticeships and prepare now? Yes, definitely. I think, as I've said before, we do recruit not just necessarily on an academic year. People could be advertising any month of the year. So definitely have a think about the subjects that you're interested in, the potential apprenticeships, and keep an eye out and look at the job sites that I recommended. For apprenticeships in 2021, should I prepare and apply now? I would only apply for apprenticeships. You need to look and see whether they are apprenticeships that are recruiting in advance or they're recruiting for an immediate start. So I think if you are not available now, then actually you need to be preparing for the next talk. Okay. Can you do a degree level apprenticeship for a healthcare science, biomedical science? And if so, it's a competitive pathway. Yes, there are definitely lots of healthcare science roles and biomedical roles. So again, I would suggest looking at that Skills for Health website that I shared, and have a look at the different pathways. But yeah, we've got a huge focus on healthcare science at the moment, really looking for fresh young talent to come and join us. So I definitely have a look on HASO and check out what's available. When is the earliest you can begin an apprenticeship? Do you mean in terms of age? If that's the case, then it would depend on the setting, but we do have apprenticeships available for 16-year-olds. Sometimes in a clinical area, they might ask for you to be 18. So again, it would depend on what kind of role it is that you're looking to do. But certainly, again, look at your local trust and the opportunities they have available, because there aren't really any age restrictions unless it is a very highly specialised clinical area. But we do take 16 and 17-year-olds, but the majority of them will be 18 plus. Where can I find degree apprenticeships in the ambulance service? So again, I would suggest looking at your local ambulance service trust. They will advertise their vacancies on there. And then you'll need to decide whether you want to go in as a level 4 or a level 6 straight onto the degree programme. But all your local ambulance trust websites will have details of their vacancies on there. But again, also sign up for NHS Jobs and also sign up for the news alerts on the apprenticeship site. For audiologists, is there any apprenticeship for that? So yes, there are. So again, it's something that you need to look at. You could potentially start in some of the lower assistant practitioner roles, but again, I would look at that career pathway tool on the HASO site that I recommended, and that will be able to show you all of the degrees that are available that you might be interested in. I do Spanish, chemistry and biology A-levels. Is taking Spanish over maths, physics will affect my application for dentistry? I think don't quote me on this, but I do think you would need maths for any of the higher level clinical degrees. So Spanish is great and obviously will help you be able to talk to potential patients, but I would look at doing maths as well if possible. I'm sorry my laptop didn't work for a while. I think I missed a bit. I'm in year 13 now. When should I apply for apprenticeships for next year? So you can start applying from essentially as soon as you've sat your exams. And as I said before, we don't necessarily stick to the academic year in terms of intakes, but you might potentially just keep an eye out for when they're going to be advertised. But you should really only apply from when you are going to be available to work. Where can the live recording of the presentation be found? I think from the other side, there's a button where you can click to ask for that to be shared with you after. Oh, Phoebe's just answered that. Information about the recordings will be released after the event. Would you recommend going to university or doing an apprenticeship? I want to be a neonatal nurse. Obviously, I'm biased because I'm National Programme Manager for Apprenticeships, but I think I would definitely suggest doing an apprenticeship. From our experience, the registered nurse apprenticeship is only 2 years old, so we've got people coming through. And the feedback from their employers are that they are hands-on, head and shoulders above the traditional nursing students because they have been on the wards from day one and getting in the thick of it. So again, it's obviously down to you, but you can definitely do it via the apprenticeship nurse. You would do the children's pathway on the registered nurse apprenticeship, and then you would do an advanced clinical practice to become a neonatal nurse. Aisha's asking, is it better to start an apprenticeship after GCSEs or A-levels? It's entirely up to you. I mean, as I said, we do have vacancies for 16, 17-year-old GCSE leavers, and we also have them if you wanted to start after A-levels, but it's entirely up to you. It depends on what career that you're looking for. As I said, I would recommend going to look at that site to look at the career pathways, and then you can make a decision. But for us, it depends. For some young people, they don't want to stay on for A-levels. They'd much rather get those hands-on practical skills. So after GCSEs is perfectly fine. But again, it will depend on the route that you want to take. Where could I find degree apprenticeships if I was interested in orthodontistry and prosthetics? So prosthetics is a huge growth area for us. It is one of the professions that we know we have got critical shortages in. So again, if you look on the Skills for Health HASO website, it will give you the career pathways that are available. And if you sign up for all your alerts for NHS Jobs and for the National Apprenticeship Service, you'll see when these vacancies will be advertised. Does this type of apprenticeship apply in Northern Ireland? Unfortunately, no, they have a different system to us. So everything I've talked about today is for England only. There are apprenticeships available, obviously, in Scotland, Ireland and Wales, but this session is focusing on the ones that are available in England. Just having a look. Oh, someone's put the pathways tools on the chat for me. That's fantastic. So yeah, I couldn't recommend it enough. It's a really great tool. And if you don't have an idea, you just feel like you do want to work in the NHS, but you want to see what roles are available, then if you click on that, you can actually, there's an option where you say, I'm not sure what I'm interested in, and it will give you some sample career pathways to have a look at. So there was lots of technical issues at the beginning, so I'm hoping people can hear me now. Social worker, is there social worker apprenticeships in the NHS? Yes. They probably would predominantly be advertised via the local authorities rather than the NHS, but we do work closely with them in certainly some areas of care. And it would be a degree apprenticeship as well. What are degree level apprenticeships? So degree levels are essentially your traditional degree, but delivered as an apprenticeship program. So it can be a level 6 degree program, but rather than you pay fees to study that at university, you're actually getting paid by your employer and they will pay your university fees for you. So you earn while you learn and you don't get student debt. So to me, I think it's a no-brainer. Seeing if there's any more questions coming in. What are the nursing midwifery apprenticeships like? So we've had really great success with our nursing apprenticeships. As I said earlier, feedback from employers are, so if you just wanted to study nursing and were doing a traditional degree, you would be at university, and then towards the end of your first year, you would go out on placements in the trust. When you're doing a nursing apprenticeship, you would be working as a healthcare assistant, potentially a couple of days a week at university. So you're actually getting to learn and embed those practical skills in a much more controlled environment. So for us, we feel that it's a really good way for people to understand what nursing is really like. What we have found as well is that the attrition rates for apprenticeships are much lower than they are for traditional degree programs, because you are actually getting those hands-on practical experience. What are the requirements to do an apprenticeship? So it would depend on the program. I would say for level 2, level 3 programs, they would ask you to have English and Maths GCSEs. They wouldn't specify any other GCSE requirements. That would be your basic entry requirement. And obviously, but if you wanted to do any of the higher level ones, then they potentially might be looking for level 5 qualifications or A levels. But again, if you go, the link's in the chat, if you go to the pathways finder, it will give you the opportunity. For physiotherapy, would you have to complete your A levels first? So it would depend. What we have found is that the some employers are using the level 5 assistant practitioner as a starting point, and then from that you can progress on to do the physiotherapy degree. So it would depend on obviously your local employer and what their model is. But if you could do your A levels and go straight into the physiotherapy degree, or you could start as potentially a rehab assistant or something like that, get your experience in the trust, and then they would support you to do the physiotherapy degree internally. That's a good point, actually. So for the last 3 or 4 years, the degree apprenticeships have been predominantly for existing members of staff, just because they've been brand new and it's been a new way of working for us. But we're finding out that for us, for some young people, it's working out better if they get that foot in the door on a lower level apprenticeship, and then they can then progress and see what opportunities are being advertised internally. Wanting to be a paramedic, however, can't find any apprenticeships. Again, what I would say is look on your local ambulance trust websites, and you should consider looking at the level 4 associate ambulance practitioner, because the ambulance trusts at the moment use that as a foot in the door, and then will fast track you on your paramedic degree. So again, as I've said before, if you're already working for that employer, you'll probably get a better sight on the degree apprenticeships that are being advertised. But doing the level 4 associate ambulance program, you would still get that hands-on practical experience, and then potentially be able to fast track onto your paramedic degree. So Aisha's asking, difficult to find apprenticeships. So the link is earlier up in the chat, but if you look at the Skills for Health, you also need to make sure you're registered on NHS Jobs and also the government apprenticeship website. Someone put the link in again, that's great. I want to become a surgeon. Would I have to do an apprenticeship before med school or after med school? So there are discussions at the moment, hot off the press, there are discussions around medical apprenticeships, but they're not going to be ready for a couple of years. So I would suggest, if that's what your heart's set on, I would look at the med school route for now. If you wanted to do an apprenticeship, in terms of anything else, then I would obviously suggest the apprenticeship route, but for medicine, it's not going to be available as an apprenticeship for a while. Okay, I can't see any more questions that we've not answered. It seems a lot of people are still having technical issues, so I'm sorry about that. Is there a website I can access all the apprenticeships? Yep, so there's several, as I said, set up alerts on NHS Jobs, set up alerts on the National Apprenticeship Service, and what you can do is you can go in and set a location, list all the ones that you're potentially interested in, and it will and then it will alert you as and when these vacancies are advertised. Aisha's asking about the paramedics, so I've covered that. But yep, if you look on your local ambulance service trust websites, they'll talk about their intakes and when they look to recruit. So you can have a look at that, or also on NHS Jobs. Are there any new apprenticeship schemes in the making? Yep, great question. We actually are getting requests from employers all the time to look at new apprenticeships. So ones that we're working on at the moment are a safeguarding role. So anybody that's interested in kind of that gap between social work and working in the NHS, that's coming. I'm just thinking of, we've probably got over 100 different apprenticeship standards developed now. So again, it can be a full range, and obviously don't just think of us in terms of clinical. If you are interested in IT, in finance, then there's still lots of opportunities to support the NHS in that way. Is it possible to do medicine after a degree apprenticeship? Again, I wouldn't want to talk about that at the moment. I think, you know, as we said, there is potentially a doctor apprenticeship coming, but you would need to look at what the entry requirements were and whether that degree apprenticeship would be suitable to allow you to progress into medicine. Okay. Is there a lot of competition for apprenticeships? Yes, there is. I'll be honest, there is, because as more and more people are realizing that they are a fantastic opportunity, and that you can actually earn while you learn, and certainly for the degree level ones where you wouldn't actually be getting any student debt, then obviously we are seeing demand increase. But I think if you have a look at all the resources and the links that I've shared, do a good application, really show that you're committed to the NHS and the values and why you want to work, then I think you've got a good chance. And as I said, the whole talent for care agenda is going back to that work experience, volunteering. So again, the earlier you can kind of get a foot in the door and kind of build those relationships with your local trust, then you're much more likely to be aware of when the vacancies are being advertised. Would you be able to go to uni whilst doing an apprenticeship? No. You can't be enrolled on 2 programs at the same time. You can either do a degree apprenticeship or go to university, but you technically can't be funded and enrolled on 2 programs at the same time. What degree apprenticeship would you recommend to do medicine after? I think I'd have to say I don't think that would be a cost-effective route for you to do, because you would still end up having to do your top-up degrees afterwards. So I mean, I'm sure there'll probably be more talks or advices from someone that can probably give you a bit better advice around getting into medicine. Did I do an apprenticeship? I'm actually an apprentice as we speak. So I have enrolled on my level 7 senior leader apprenticeship. So it's going to allow me to do my master's in senior leadership. And I'm very, very proud of that. And I do think, so I've got 3 children. My eldest is 26. He did the traditional route and went to university. But for my 2 younger ones, I will certainly be encouraging them to do an apprenticeship. You know, with the range that's available now, not necessarily in the NHS, but you know, there's such a huge range of apprenticeships that are available, and I just do think they are a fantastic opportunity to get those, to get the same qualifications, but also just get that practical work experience, which is what really employers are looking for. Any more questions? Oh, I'm not sure how long we've got left, but if there are any more questions, do drop me a line. Are there any disadvantages to apprenticeships? Great question, Phoebe. I think you need to be realistic around an apprenticeship, because essentially it is a full-time job and a full-time course. Obviously, they work out the measures for that, but you need to be realised that, you know, you're going to have to come home after a full day's work and potentially, you know, do an assignment or finish an assignment. You do get 20% off the job, so that is 20% protected time that you are able to concentrate on your studies and learn the knowledge part. So for me, I don't think there are disadvantages, but you just need to be able to make sure that you are organised, that you can juggle your time effectively, and that you know it's something that you really want to do. So I don't, from my perspective, I think, you know, the biggest thing for me is essentially degree apprenticeships. You get your degree paid for. You're not going to be paying back 50,000 to 60,000 pounds worth of student loans for the next 10 years. You can actually get paid and still get your degree. So for me, they're a no-brainer. Is an apprenticeship harder than going to uni and doing a degree? I don't think so. I think that it's less daunting, because while you're in the classroom, you're then getting the opportunity to go back to the workplace to put into context and practice what you've learned. So I think, from, you know, as I said, if you're organised and committed and it's really what you want to do, then I think it's a fantastic opportunity. It will make sure that, you know, you are getting to embed those skills. And I used the example earlier on about digital. You know, with the digital ones, what you learn in the first year could be out of practice by the time you've done your third year. So at least with an apprenticeship, it can evolve with you, and you can make sure that you're getting the skills that you need. Do you think apprenticeships are more or less easy to manage than university when you have anxiety or depression? That's a good question, and I think obviously, you know, mental health is a huge focus at the moment, and I think if you've got a supportive employer, then I don't think it should be any harder. And actually, you'll probably be surrounded by a lot of professionals that can support you if you are anxious about anything. And I think obviously just being in a hospital, in a caring environment, they should be able to signpost you to any additional support that you might need. So I think, you know, probably a good idea, if it is something you're worried about, is to do some volunteering or to try and have work experience, so then you can actually get a real idea of what it's going to be like, what the environment is going to be like, and hopefully that should kind of manage to put some of the anxiety to bed. How do you know who the right employer is? That's a good question as well. I think that's something, when you do go for interviews, you need to be thinking it's not just a case of whether you're going to be right for that employer, it's whether they're going to be right for you as well. So I think, you know, as well as having questions, obviously they're going to have set interview questions for you. I would make sure that you have a couple of questions that you can ask them and understand, you know, about the values of the organisation. How do they support their staff? Are they going to give you career progression opportunities? So I think that's a really good question. So have a look at who your local employer is. Quite often in lots of cities, the NHS is the biggest employer. So just find out who your local trust is, but also remember that there is primary care as well. So there's doctors, surgeries, there's pharmacists. So it's not necessarily all the big, large employers. There's lots of little employers in the NHS as well. Okay, any more questions? I see lots of people entering. Oh.
Hi.
Hi. Are we done?
Well, you still have a little bit more time, so if anyone any final questions. I don't see any coming through, but thank you for coming and doing that talk. It was really useful, and there's been lots of questions that I think have helped people a lot.
Are they going to be able to get access to the slides? I think, because I thought about that. There's lots of links in there that might be useful.
Yeah, I think so. The recordings are definitely going to, I think they're being put up on the website after the event day. So I think they should be able to access that, but there'll be more information sent out later.
Okay, brilliant.
But if no one has any final questions.
Well, thank you very much for attending, especially on a Saturday. I do appreciate it. That shows good commitment, and I hope you found it useful.
Thank you so much for coming and talking to us today.
Bye, everybody.
Thank you. Bye.